The Ebola outbreak in Western Africa has claimed more lives. A Nigerian nurse has died and a Saudi man who traveled home from Sierra Leone with a suspected case. African health ministers held an emergency meeting on the virus Wednesday, the death toll at more than 930. In Washington, President Barack Obama at this week's Africa Summit says the U.S. and its partners
stand with the people of Guinea, Liberia, and Sierra Leone. In their histories, they've overcome great challenges, and they are drawing on that same spirit of strength and resilience today.
But the most affected nations may lack the resources to quickly spot and contain Ebola. Nigeria says its 5 new confirmed cases stem from a Liberian man who flew there while symptomatic when Ebola is contagious. He wasn't immediately suspected and put into an isolation room, a standard procedure should anyone suspected of having Ebola arrive at a U.S. hospital.
We have several in the emergency department as well as our regular floors in ICU where the airflow moves in a way so that any infectious bacteria, germ, if you will, can't flow out into the general zone.
U.S. health experts say the risk of transmission here is very low. 2 infected missionaries flown from Liberia and in isolation at an Atlanta hospital are improving, possibly due to an experimental drug ZMapp. But the treatment is raising ethical questions about who gets first access to promising but unproven therapies. ZMapp has never been tested on humans, is in limited supply, and it would take months to ramp up production. Cindy Sharp, Associated Press.